Hello, and welcome to It's All About Your Health, Straight Talk with Dr. Nancy. My name is Nancy Greer-Williams, and I am a health researcher for the University of Arkansas for Medical Sciences.
HIV is a germ. It's a germ that once you're infected with it, it stays with you for the rest of your life. At this time, we don't have a cure. But this germ can be treated with medicine, and if it's treated early, and if people stay on their medicine, then they can essentially live a happy and healthy life. HIV is a germ, as I said, and it lives in the blood of people who already have the infection. It also seeps over into their secretions, so into their breast milk, into their sperm, and some of the other secretions in a smaller amount. So if you are injected with somebody's blood who has HIV, and that could happen if you share syringes, if you use IV drugs, or if you were to have anal sex with an individual who was infected and there was ripping and tearing of tissues, then blood could leak out and you could become infected that way. So those are a couple of the common ways that we talk about becoming infected. Some kind of sexual contact or use of IV drugs are the most common ways. And the third way, which is not as common, is if a mother has HIV and she has a baby, the baby can acquire infection at the time of delivery. You can be infected with this germ and not know it. You can be walking around thinking you're healthy when in fact this germ is inside your body eating away at your immune system. If your immune system, and that's the part of your body that fights off other infections, breaks down, then you begin to get disease. And the diseases are all those unusual infections that you usually don't get because you're healthy. But when this germ causes your immune system to break down, you get a whole lot of other type of infections and problems. Today, it is easier to figure out for yourself whether you've got HIV than any other time before. There are tests that you can go and buy at a pharmacy like a Walgreens or Walmart. Cost about $40, but you can buy a kit so that you can do a little test from the inside of the secretions on the inside of your mouth, and you can test whether or not you have HIV or not. There are other tests that sometimes use a drop of blood from a finger stick or other things to do that as well. So you can do this anonymously. You can go and buy these things. If you can't afford that money, you can go to your local health department. There's one in every county in this state, and they will do confidential, quick, rapid tests to determine whether you have infection or not, or they can do a blood test to do an even better test of whether you've got HIV or not. If you had made that diagnosis in 1985, it would be, in essence, a death sentence. But that day has passed. We have incredible medications now that are easy to take, often one pill a day or two pills once a day, that will allow you to fight the germ off, this infection off, so that it can't harm you. But you do have to take the medicines every day. If you are diagnosed with HIV by a doctor or by a health department, the Department of Health will contact you and help you find doctors or other providers to help you with all your needs in taking care of your HIV. If you don't have insurance, you can qualify for what's called the Ryan White program, which will allow you to receive your medications, your doctor's appointment, and other services you might need for free. If you have insurance, but it doesn't cover all the expenses, then some of these programs can help with those other expenses as well. Once a diagnosis is made and you share it with your doctor, that is a piece of information that is very, very, very confidential and cannot be shared with anybody without your permission. If you do tell other people about it, and we encourage our patients to share this information with their families or some other person they trust so that they can have emotional support for it. The issue of whether or not people will treat you differently if they have this information is a big issue. And there are a lot of people around now who understand that this is an infection just like any other infection that we treat that might be caused by sexual contact, whether it be syphilis, gonorrhea, chlamydia. All these diseases we now know are treatable. We all know that we shouldn't catch them if possible, and we should try to prevent the spread. But it is an issue, and I think one has to be careful to keep this information within a circle of people that you trust. The people that need to get tested are people who fall in certain risk groups. The biggest group is if you're sexually active or have been sexually active, you need to be screened. And if you've been screened at least once as an adult, but you're otherwise living in a relationship just with one person and have been doing so for a long time, then that's all you need to do. But if you are in a group where you are using IV drugs or you have multiple sex partners, you're in a higher risk group and you probably ought to be screened once a year. You always have the right to ask your doctor to do this test for you. And your doctor should offer you, after they take your history and understand what your risk factors are, they should offer that test to you. But let's be honest, not all doctors remember what they're supposed to do, and if you're in there for another type of problem, like a cold or pneumonia or an abscess, they may not remember to ask. So please ask your doctor. Be forward at asking them to get the test. One of the things people worry about is if they don't get diagnosed until the infection is at the point where they are starting to have breakdown in their immune system and they've got severe illnesses that put them in the hospital. They might even be on a ventilator, breathing machine, so that they're having to have a machine breathe for them. Even at that point, if they start getting treatment, they can have complete reversal in their symptoms and their illnesses so that they can get back to being normal. We watched this happen in the mid-90s when we had no medicine for HIV. But when we got the right medicines, people who were literally lying on their deathbeds were able to get back up and walk again and be healthy and go back to work and live a normal life. And that still happens today. Sometimes patients don't know they have HIV disease until they wind up in a hospital bed, but they can absolutely completely recover. So today, it is so easy for a person who has this infection to take control of their lives and be healthy and strong, and so that they can go on to have children, to have a good job, and be healthy and strong. The only thing they have to do is get diagnosed and get on treatment, and that's what we need people to do. There's been huge advances in three different ways. Number one, the number of medicines one has to take has dropped dramatically. It used to be that people had a couple of dozen pills a day they had to take. For many patients who are newly diagnosed now, they can get away with a single combination medicine that they take once a day. So that's dramatically improved. Number two, the side effect profile is so much better. It used to be that these medicines caused all kinds of problems with diarrhea and stomach aches and headaches and nerve problems. The medicines have gotten better and better and better, and we now have generations of excellent medicines. We also know that there's a lot of resistance to the HIV germ, and so that not all medicines work. But the newer medicines that we have are even better than ever, and they're good for all these strains that are resistant. And so that's very helpful too. So we can almost always find some combination that works for patients. There's another thing I wanted to bring up, which is the risk that you bring to other people that you care about if you're not diagnosed. So if you're a young woman and you get pregnant and you have a baby, it's critical that you be diagnosed early so that your baby doesn't become infected with the HIV virus. We now know that with treatment programs, greater than 99% of infants can be born to women who are HIV positive if they get on an appropriate medicine treatment program and the baby gets treated after they're born. But you can't do that unless you're diagnosed. The other thing is that if you have HIV and you're having an active sexual life, then you're passing that germ on to other people that you obviously care about, and that can cause them great harm too. So it's very important to be diagnosed. It's also actually the law in this state that if you have HIV and do not inform somebody, then you can be prosecuted for that if you give them an infection and they suffer harm from it. So it's important to know you've got the infection and important to inform those people that you might have a sexual relationship with about that. If you're using condoms, it's a very, very effective tool to prevent spread. But sometimes condoms break, and sometimes people forget to use condoms or they don't have one available. So I want to reinforce your message. Yes, you should always use condoms, whether you know you have HIV or not. There are many other infections that can be spread as well. So using condoms is really important, but they're not 100%.
Thanks for watching. Our goal for this program is to give you good information that you can trust on health topics that you can use for you and your family to live a long, healthy life. If there is something in this message you want to know more about and you live in the state of Arkansas, take a moment to talk with one of our health experts at your local area health education center.